Well, Florida Senator Rick Scott just wrote a Fox News op-ed. It's titled, "I grew up in public housing and I know how to fix Obamacare." And he joins us now to talk about it. Florida Senator Rick Scott, great to see you again. Thank you for being here. I had forgotten that you grew up in public housing. I used to teach, by the way, in public housing outside of right in Chicago, actually. Cabrini Green doesn't exist anymore because the whole thing was so debt-ridden and rat-ridden and full of drug dealers that they just tore the whole project down. Anybody who's lived in public housing, well, you've got a message for those socialists who want to put everybody else in public housing. What is that message?
Well, first off, I didn't know, my parents wanted to get out of public housing. And, I don't know anybody that said, man, I want to grow up to live in public housing.
Right.
Okay? I want to grow up and be on the government dole. No, they don't. People grow up to be independent. We all loved our parents, but we didn't like being told what to do. None of us want more government. We know that government has caused food prices to go up, housing prices to go up, car prices to go up, and healthcare prices to go up. It's not more government. We need less government, more opportunity.
But Mamdani wants to literally eliminate private housing. He calls it decommodifying. That's Marxist jargon for removing the value out of an asset. And he wants to give $55 trillion worth of private housing that Americans have over to the government. Do you think it'll work out as well as the other public housing projects?
No, it's not going to work. Government housing programs, they don't work. People want to get out of them. I mean, look, we all want to help people that need help. Every one of us. I mean, my heart goes out to people that need a helping hand from government. But the people I know want to get out of public housing, want to get off of food stamps, want to get off of any government program they can.
And private health care, of course, is another thing that the socialists want to get rid of. They say public or essentially socialized medicine is the way to go. At least Bernie has the honesty to say that. A lot of them feel that, and Obamacare was a part of that. That was the camel's nose under the tent that would lead to socialized medicine. You say you can fix Obamacare. I would hope that we get rid of Obamacare, but how can you fix Obamacare?
Well, first off, I think it's important that people have access to health care. I watched my mom struggle to get health care for my brother when he had a disease, all right? We didn't have insurance. She was trying to get health care. She ultimately, in our hometown, nobody would take care of him for free because she had no money. So we went to a charity hospital 4 hours away. So let's take care of the people that need health care. But here's what the Democrats have done. With Obamacare, they said you get to your doctor. Lie. You keep your plan. Lie. You're going to save $2,500 a family. Lie. What's happened since Obamacare? Co-payments are up. Deductibles are up. Premiums are up. So how do you fix it? You give them money. If you're going to help somebody, give it to them in a HSA where they have an account that they'll spend on health care. They can buy direct health care, they can pay for co-payment, premium, deductible, and let them buy the insurance that fits their needs, what they want. This idea that the government can decide what health care you need for every family and they're all the same is a fallacy. Let people buy what they want, and guess what? They're going to shop. They're going to find the best deal.
Yep.
They're going to take care of their kids. That's what we need to do.
Now, we should mention, by the way, you were in the healthcare industry, so you know whereof you speak. I just wonder, you're focusing on folks who qualify for Medicaid and giving them the money. What about folks who are well off enough, thank goodness, so that they buy their own insurance? Would you make the purchase of that insurance tax-free or do some kind of bonus that would get them around the government option?
I think we ought to look at all those options to make sure people have access to health care. But remember, health care insurance with a $10,000 or $15,000 deductible is not much health care. What we've got to do is we've got to figure out how people can see a doctor, go to a hospital, go to a chiropractor, get the health care they need. And the way to do that is when people have needs, give them the cash to buy their own.
Yes.
We do food stamps that way. We don't give the money to a grocery store. Let's don't give it to an insurance company. Then the grocery store says, oh, here's what I'm going to give you, what type of food. You're going to need a lot more broccoli this week because it's been on sale. No, let's don't give it to the insurance company. Let's give it to the family.
The incredible thing about the left, on the one hand, they lionize an accused murderer of a healthcare CEO. On the other hand, they're all in favor of subsidizing health insurers. How does that make any sense?
It makes let's quit giving money directly to insurance companies. All right, let's give money to the individual. Look, my parents never made any money. I don't think my parents ever made $10,000 a year in their life. Guess what? They could shop.
Yeah.
They knew what drugs cost.
Yes.
All right, and they shopped for it, and they took care of themselves.
Senator Rick Scott, a pleasure to hear your common sense. And again, you know whereof you speak. You've been there, done that. Good to have you here. Have a wonderful holiday season. Thanks for being here.
You too, David. Bye-bye.
Appreciate it.